Dr. Rebound here. Let's do our um, medical term of the day. And that term today is hematohydrosis. Or hematohydrosis is a very rare condition where you sweat blood. Now, this could look very, very evil. It can also affect the tear ducts and some other moisture, mucus appearing or producing areas. Imagine you talking to somebody and all of a sudden blood starts coming out of their eye. That would be fairly alarming. Hematohydrosis, they think, is caused by an abnormal reaction to stress. That when you get so upset over something that you produce extra catecholamines that in effect burst the capillaries that surround your sweat glands. So blood leaks out and then comes out in your sweat. Um, Now, I'm not talking about gushing blood. If you can imagine, the capillaries around sweat glands are very, very, very small. And if you rupture those, it's going to leak a few red blood cells and then it's going to tinge your sweat red. But there are some where you actually can bleed a little bit more to where it becomes very obvious. See it on the face, the forehead, coming out of your ears. Like I said, tears. So it can be a very alarming situation. Treatment wise, there's really not been a whole lot done on this because it's really not that common. But there have been case reports of prisoners prior to execution doing this, and I can imagine that would be very, very stressful. But treatment wise, they've used a type of blood pressure medicine called beta blockers that can cut down on the effect of epinephrine, which may help somewhat. But other than that, not a whole lot of work's been done on this. So if you're crying blood, sweating blood, you get upset and you start looking like one of those toads that squirts blood out of its eyes, then that is hematohydrosis.